High cholesterol is often called a silent threat because many people feel perfectly normal while fatty deposits slowly build inside their arteries, reducing blood flow to the heart and increasing the risk of heart attack, stroke, hypertension, and dangerous heart blockage. And one of the biggest mistakes people make is believing that cholesterol can only be controlled through medicines while ignoring the powerful role daily habits play in protecting the heart, because the truth is that your everyday routine, from the moment you wake up until the time you sleep, can either help clean your arteries or slowly damage them over time. And in today's detailed discussion, Dr. Aliasgar Bahrainwala explains 5 highly effective daily habits that doctors commonly recommend for controlling high cholesterol naturally and supporting long-term heart health, beginning with the first and perhaps most important habit: regular physical activity, because exercise acts like a natural medicine for your cardiovascular system by helping increase good HDL cholesterol while lowering bad LDL cholesterol and triglycerides. And many people underestimate how powerful simple movement can be, thinking only intense gym workouts matter, when in reality even brisk walking for 30 to 40 minutes daily can improve blood circulation, help burn unhealthy fats, control blood sugar, reduce stress hormones, improve blood pressure, and support healthy artery function. And this becomes especially important for individuals who sit for long hours due to office work, because prolonged sitting slows metabolism and contributes to weight gain and cholesterol buildup. So incorporating movement throughout the day, taking stairs, stretching, walking after meals, standing more frequently, can significantly improve heart health over time. And the second important daily habit is improving diet quality and reducing processed foods, because cholesterol problems are strongly linked to what people eat every day. Especially foods high in trans fats, excessive saturated fats, refined carbohydrates, processed meats, deep-fried snacks, sugary desserts, packaged fast food, and excessive salt intake, which all contribute to inflammation, obesity, insulin resistance, and plaque formation inside arteries. Whereas replacing these foods with heart-friendly options like vegetables, fruits, oats, nuts, seeds, legumes, olive oil, fish rich in omega-3 fatty acids, and fiber-rich whole grains can gradually help lower LDL cholesterol levels naturally. And one of the most important dietary strategies is increasing soluble fiber intake, because soluble fiber binds cholesterol in the digestive tract and helps remove it from the body before it enters circulation, which is why foods like oats, barley, apples, beans, lentils, and flax seeds are so beneficial for heart patients. And many people also forget that portion control matters greatly, because even healthy foods eaten in excess can contribute to weight gain and metabolic problems, while late-night heavy meals further worsen cholesterol control and increase the burden on the heart during sleep. And the third daily habit recommended by doctors is maintaining healthy sleep patterns, because poor sleep has a surprisingly strong connection with cholesterol imbalance, weight gain, elevated stress hormones, high blood pressure, and increased cardiovascular risk. And modern lifestyles filled with late-night screen exposure, binge-watching, stress, irregular work schedules, and excessive phone use have created widespread sleep deprivation that silently harms heart health over time. Because when the body doesn't get enough restorative sleep, hormonal balance becomes disrupted, cravings for unhealthy foods increase, blood sugar control worsens, inflammation rises, and cholesterol metabolism becomes abnormal, making it easier for bad cholesterol to accumulate in arteries. So maintaining a consistent sleep schedule, reducing screen exposure before bed, creating a calm sleeping environment, and aiming for 7 to 8 hours of quality sleep every night can have a major positive impact on heart health and cholesterol control. And the fourth critical habit is stress management, because chronic stress places tremendous pressure on the cardiovascular system and contributes directly to unhealthy lifestyle behaviors, including emotional eating, smoking, alcohol consumption, overeating, poor sleep, lack of exercise, and increased blood pressure. While stress hormones like cortisol may also negatively influence cholesterol levels and artery inflammation over time, and many people live under constant mental pressure without realizing how deeply stress affects the body physically, which is why doctors encourage simple but powerful stress reduction techniques such as deep breathing exercises, meditation, prayer, yoga, spending time with loved ones, engaging in hobbies, limiting unnecessary negativity, and making time for mental relaxation daily, because even a few minutes of calm breathing can help reduce heart strain and improve overall cardiovascular balance. And the fifth essential daily habit is avoiding smoking and limiting alcohol consumption, because tobacco smoke damages blood vessels, increases artery inflammation, reduces oxygen delivery to the heart, lowers protective HDL cholesterol, and dramatically accelerates plaque formation inside arteries, while excessive alcohol intake contributes to weight gain, high triglycerides, elevated blood pressure, irregular heart rhythms, liver stress, and worsening cholesterol levels. And many people wrongly assume occasional unhealthy habits are harmless while their arteries slowly suffer cumulative damage over years, which is why quitting smoking remains one of the most powerful decisions for protecting the heart and improving long-term survival. And beyond these 5 major habits, there are several additional lifestyle principles that can significantly support cholesterol control, including maintaining a healthy body weight, because excess abdominal fat strongly increases cardiovascular risk and contributes to metabolic syndrome, diabetes, inflammation, and elevated LDL cholesterol, while even modest weight loss can produce measurable improvements in cholesterol numbers and blood pressure. And hydration also plays an important role, because proper water intake supports circulation and overall metabolic function. While regular health checkups remain essential, because cholesterol problems often develop silently without obvious symptoms until a serious event like chest pain, heart attack, or stroke occurs, making routine blood tests, blood pressure monitoring, diabetes screening, and medical evaluation extremely important, especially for individuals with family history of heart disease, obesity, smoking, sedentary lifestyle, hypertension, or diabetes. And another important misconception that must be addressed is the belief that younger people are protected from cholesterol problems, because increasingly doctors are seeing high cholesterol, obesity, hypertension, and early artery disease in younger adults due to processed foods, stress, lack of exercise, poor sleep, and unhealthy routines, meaning prevention must begin early rather than waiting for symptoms to appear. And while medications prescribed by doctors can be life-saving and necessary for many patients, lifestyle changes remain the foundation of long-term heart protection, because medicines alone cannot fully overcome the damage caused by unhealthy habits. And patients who combine medical treatment with proper lifestyle correction often achieve the best outcomes: better cholesterol control, improved energy levels, healthier blood pressure, reduced inflammation, and lower risk of future heart complications. And one of the most encouraging aspects of cholesterol management is that the body can respond positively to healthy changes surprisingly quickly, because within weeks of improving diet, increasing activity, sleeping better, and reducing stress, many individuals begin seeing improvements in blood pressure, energy, weight, blood sugar, and cholesterol profiles, demonstrating that small daily habits repeated consistently can create powerful long-term protection for the heart. And this is why prevention matters far more than waiting for emergency symptoms, because once severe blockage develops or a heart attack occurs, treatment becomes more difficult, costly, stressful, and sometimes life-threatening, whereas daily discipline today can help preserve heart function and quality of life for years to come. And ultimately, the message is simple but extremely important. High cholesterol is not something to ignore, but it is also not something to fear helplessly, because with the right combination of medical guidance, healthy routines, proper nutrition, movement, sleep, stress management, and avoiding harmful habits, many people can successfully control cholesterol levels and greatly reduce their risk of heart disease, allowing them to live longer, healthier, and more active lives while protecting the heart that works tirelessly every second of every day.